Hello, I am Director Tae-Young Han of banryong Insu Oriental Clinic. Today, I will lecture on the constitution and drugs of colorectal cancer patients. Welcome to our session on Sasang typology. We are demonstrating the efficacy of herbal medicine in stage 4 colorectal cancer treatment, showcasing both standalone curative and synergistic remission cases. Beyond the prognosis, we integrate constitutional herbal therapy in advanced stage 4 colorectal cancer, reviewing standalone and synergistic clinical reviews. Our focus is on overcoming stage 4 colorectal cancer through standalone and integrative herbal efficacy, specifically in SOEM or winter-type patients. The dual paradigm of integrative oncology involves monotherapy intervention for frail patients and synergistic integration to overcome chemoresistance. The clinical paradigm for winter-type physiology involves identifying the Sasang constitution and applying a targeted pharmacological catalyst. Case 1 involves a 75-year-old female SOEM type who was initially misdiagnosed with primary lung cancer, leading to a crucial pivot in her treatment path. After being misdiagnosed and undergoing surgery, she was found to have stage 4 rectal cancer with lung metastasis. She opted for standalone herbal therapy. This radiology callout shows a solitary nodular opacity. The post-surgery bowel obstruction revealed the true primary source of her cancer. The true pathology was stage 4 rectal cancer with a classic apple core appearance. Chemotherapy was deemed unviable due to her advanced age and frailty. This showcase documents the regression of stage 4 colorectal cancer through targeted herbal medicine, specifically for the SOEM body type. The initial examination revealed an annular constricting tumor in the rectum, causing severe luminal narrowing and obstruction. After 3 months of standalone herbal therapy, the diameter of the rectum almost recovered, and the mass completely disappeared. The radiological resolution timeline shows a 45mm mass at 0 months, partial reduction at 1 month, and near complete resolution at 3 months. The radiological evolution documents the complete disappearance of the apple core lesion and the restoration of the rectal lumen. This timeline highlights the progressive tumor regression leading to complete radiologic disappearance, as confirmed by the radiologist's impression. The long-term efficacy is sustained health and survival exceeding 5 years, demonstrating potent anti-neoplastic efficacy of tailored herbal medicine. Case 2 involves a 31-year-old female SOEM type with a post-surgical relapse of colon cancer, specifically signet ring cell carcinoma. This young adult faced a highly aggressive recurrence with rapid, extensive systemic dissemination. Conventional prognosis was deemed hopeless. The challenge of stage 4 cancer with distant metastases requires tailoring oncology treatment to constitutional typology rather than just tumor histology. Chest CT revealed extensive lymphadenopathy in the bilateral supraclavicular and mediastinum areas, indicating tumor necrosis. Abdominal and pelvic CT showed advanced colorectal cancer involving the distal sigmoid to mid-rectum with extensive local invasion. Widespread dissemination included lymph node enlargement and superior rectal vessel infiltration, accompanied by small pelvic ascites. The baseline PET-CT from September 2012 showed multiple bone metastases involving the spine, ribs, scapula, and bilateral femurs. The widespread dissemination affected the skeletal system and soft tissues, presenting a grim prognosis for this advanced stage 4 case. Pathway B involves a synergistic intervention using ROO52 herbal medicine combined with FOLFOX chemotherapy over a 2-month protocol. The systemic clearance after just 2 months showed dramatic improvement in lymphatic and skeletal areas, which is extraordinarily rare. 2 months of combination therapy resulted in the improvement of multiple bone metastases in the spine, ribs, and pelvis. The radiologic response at 2 months showed remarkable lymphatic clearance and rapid skeletal improvement across the entire body. The PET-CT from November 2012 confirms the success of the 2-month combined therapy with FOLFOX and herbal medication. Overcoming refractory bone metastasis is a breakthrough. Such rapid clearing suggests a powerful synergistic amplification driven by the herbal adjunct. The synergistic intervention protocol involves standard FOLFOX chemotherapy and Sasang typology herbal medication to modulate the immune microenvironment. While chemotherapy alone often struggles with bone metastases, the integration of constitutionally matched herbal medicine provides a powerful effect. The bimodal therapeutic matrix compares the standalone pathway for fragile patients and the synergistic pathway for aggressive cases. The R00052 herbal medicine is a highly specific biological key, acting as an anti-neoplastic driver or a vital synergist depending on the case. By shifting the microenvironment, we fundamentally alter the gut microbiome and empower beneficial flora to suppress harmful agents. In conclusion, constitution-tailored herbal medicine delivers measurable effects and yields rapid systemic clearance of resistant metastases. This progress review from 2002 to 2003 shows much progress in a 45-year-old male patient using constitutionally aligned therapy. Efficacy in stage 4 cancer is not solely about the drug's mechanism, but its resonance with the individual host's constitution. Predicting chemotherapy outcomes via Sasang typing allows us to align standard of care pharmacology with foundational metabolic baselines. We must classify the pharmacological arsenal. Winter or north drugs like 5-FU and oxaliplatin resonate natively with the So-In constitution. The FOLFOX regimen is pure synergy for the So-In patient, with a total score showing complete constitutional compatibility. Targeted therapies like bevacizumab and cetuximab act as constitutional boosters, further amplifying positive metabolic outcomes. The FOLFIRI regimen represents a constitutional clash. Irinotecan fundamentally disrupts and overpowers the metabolic foundation of a So-In patient. Outcome A shows that a constitutional match leads to 100% synergy, marked clinical improvement, and sustained quality of life. Outcome B shows that constitutional conflict leads to adverse reactions, rapid metabolic resistance, and worsening of the patient's condition. Precision prescribing for So-In patients identifies FOLFOX as optimal, while FOLFIRI carries a high risk of adverse response and should be avoided. The future of personalized care demands integrating modern genomic markers with foundational metabolic constitutions for true precision oncology.